Chronic kidney disease, otherwise called chronic renal disease or CKD, is a condition portrayed by a continuous loss of kidney capability after some time. What is chronic kidney disease? Chronic kidney disease incorporates conditions that harm your kidneys and lessening their capacity to keep you sound by separating squanders from your blood. On the off chance that kidney disease deteriorates, squanders can work to undeniable levels in your blood and cause you to feel debilitated. You might foster inconveniences like #hypertension, #pallor, low blood count, #feeble bones, #poor dietary wellbeing, #nerve harm. Kidney disease realities. 1. 37 million American grown-ups have CKD, and a huge number of others are at expanded risk. 2. Early location can assist with forestalling the movement of kidney disease to kidney disappointment. 3. Coronary illness is the essential driver of death for all individuals with CKD. What are the gamble variables of chronic kidney disease? Anybody can get chronic kidney disease at whatever stage in life. Be that as it may, certain individuals are more probable than others to foster kidney disease. You might have an expanded gamble for kidney disease if you #have diabetes, #have hypertension, #have a family background of kidney disappointment, #are more established, #have a place with a populous bunch with a high pace of diabetes or hypertension, like African Americans, Hispanic Americans, Asian, Pacific Islanders, and American Indians. What are the side effects? The vast majority might not have any serious side effects until their kidney disease is progressed. In any case, you might see that you 1. Feel more drained and have less energy, experience difficulty concentrating. 2. Have an unfortunate craving, experience difficulty dozing. 3. Have muscle squeezing around evening time. 4. Have enlarged feet and lower legs. 5. Have puffiness around your eyes, particularly toward the beginning of the day. 6. Have dry, bothersome skin, need to pee more regularly, particularly around evening time. What will occur assuming my primary care physician suspects chronic kidney disease? Your primary care physician will need to pinpoint your conclusion and check your kidney capability to assist with arranging your treatment. The specialist will play out these blood and pee tests. Egg whites to creatine proportion pee test. Albumin is a protein that ought not be tracked down in pee and shows kidney capability issues. Blood test for creatinine. This decides whether there is an excess of creatinine, a byproduct, in the blood. Glomerular filtration rate, GFR. The specialist will work out your glomerular filtration rate, GFR, utilizing the outcomes from the tests and different elements like age and orientation. The after effect of the GFR is the most effective way to gauge your degree of kidney capability and decide your phase of kidney disease.